This video is about pain medicine for children after outpatient surgery. Outpatient surgery can sometimes be called same-day surgery. Here at Lurie Children's Hospital, we know that being a parent is hard work, especially when your child has just had surgery. After surgery, our doctors and nurses will partner with you to maximize your child's comfort and to minimize their pain. Sometimes it may not be possible for a child to be completely pain-free after surgery. Before you go home, our staff will work with you and your child to practice communicating about pain. The goal is to understand what works best for you and your child to effectively and safely manage pain at home. For example, your doctor may recommend that you use a pain scale. Some scales have faces, and some just have numbers from 0 to 10. Your child can point to a pain scale to show how much pain they are having. If your child had no pain and could run around with their friends, their pain would probably rate at a 0. On the other end of the scale, if their pain was so bad that they could not sleep and it made them cry, they couldn't eat or drink or play a video game, they might say their pain was an 8 or 10. Your goal should be to help your child be as comfortable as possible. This might mean they have some amount of pain, but can still comfortably eat, drink, sleep, and do some activities. If your child cannot point or speak, talk to your healthcare team about how your child communicates they are in pain. In addition to pain medicine, your healthcare team can recommend other things you can also do to help your child cope with pain. The rest of this video will only focus on pain medicines. These are also called analgesics. There are basically 3 types of pain medicines you need to know about. Acetaminophen, NSAIDs, also called non-steroidal anti-inflammatory drugs, and opioids. They have many different names. There are brand names and generic names. This can be confusing, so let's go through each type of pain medicine one at a time. One of the most common medicines used to help manage pain is acetaminophen. You may also know it by the brand name Tylenol. Another type of medicine used to help manage pain is called non-steroidal anti-inflammatory drugs, or NSAIDs for short. You may know the names of some NSAIDs, like ibuprofen, with brand names like Advil or Motrin, or naproxen, with the brand name Aleve. One thing to know about NSAIDs is that taking more does not treat more pain and does not relieve pain any better. Just as a warning, you do not need a prescription for most acetaminophen and NSAIDs, but just because you can buy these medicines without a prescription, it does not mean that they are completely without risk. Follow the directions for how often and how much your child should take to treat pain. Taking more than the recommended amount is dangerous. When in doubt, check with your doctor, nurse, or pharmacist. Also, depending on the type of surgery, your child may need stronger pain medicine that requires a prescription. These medicines are called opioids. Opioids are meant to be used for a short period of time, especially in the beginning of a child's recovery after surgery. Here are the names of a few commonly used opioids that your doctor may prescribe: oxycodone, hydrocodone, and hydromorphone. If your child is given a prescription for opioids, you can watch the video on the safe use and disposal of opioids to learn more about this type of pain medicine. You may be wondering, Why are there so many different types of pain medicines? Each medicine works differently inside the body. Some medicines work directly on the area causing pain. Other medicines change how the body and brain respond to pain. So, using multiple types of pain medicines is one way to help your child feel as comfortable as possible without using too much of any one medicine. When given multiple options for pain control, make sure to take each medication according to their prescription instructions. For example, your doctor may prescribe Tylenol and Advil every 6 hours as needed for pain. You can alternate these two because Tylenol and Advil are different types of medicines. Here's how that might work. If you give your child Advil at 9, you could then give them Tylenol at 12, and then give them Advil again at 3, and then Tylenol again at 6. You can see here that neither drug is being taken more than every 6 hours. Your doctor will tell you which medications you can alternate. Sometimes, opioids are combined with acetaminophen to make one pill or one liquid that contains both types of medicine. If your child takes one of these combined medicines, they cannot also have any other forms of acetaminophen at the same time. It is important to get ahead of the pain. This means giving the right medicine at the right time to help your child stay as comfortable as possible. In other words, you do not want to stop the medicine and then wait until they are in a lot of pain to give more. Asking your child about their pain and following the medicine schedule from your doctor will help you know when your child might need some more medicine. Many parents wonder if they should wake their child up to give scheduled pain medicine. Generally, yes, you should wake up your child to give medicine to stay ahead of the pain. But always ask your doctor about the best plan for your child. Every child is different, and every medical situation is different. The amount of medicine and the timing of the medicine will depend on your child's age, weight, and other factors. It is important that you follow the specific plan the doctor gave your child. Emergencies and calling your doctor. Sometimes, even if you give your child pain medicine correctly, they may still feel very severe pain. If this happens, you should call your doctor's office to see if there are additional options to manage your child's pain at home. If your child is inconsolable with pain or anxiety, and you have exhausted all options at home, you may need to bring your child to the hospital or to your doctor's office. If you need a same-day appointment at an outpatient clinic, please call before you go to ask if this is an option on that day before you arrive to the clinic. At night or on weekends, you may need to go to the emergency department for urgent treatment of the pain. If at any point your child is struggling to breathe, short of breath, panting, or turning blue, you should call 911 for immediate emergency help. Don't be afraid to ask questions. Remember, everyone's goal is to provide the best pain care for your child to help with a quick recovery. The goal of pain care is to help your child get back to regular activities safely. If you have other questions, please ask your healthcare team.